We are Pennino Family Dentistry in Barrington, Illinois, and we focus on restorative and cosmetic dentistry. My name is Dr. Connor Pennino. I've been practicing for 6 years as a dentist here at Pennino Family Dentistry. I went to the University of Iowa and studied dentistry. I actually spent 8 years there. And I miss most the small town feel and the Midwest attitude of Iowa City. So here in the office, I focus on all parts of restorative dentistry, but I have a main focus on anterior bonding. So we spend a lot of time in continuing education, and we spend a lot of time specifically with SPEAR. So we're involved in continuing education through their curriculum in Scottsdale, and we also are members of a study club here in town, run out of this office, where we focus on staying up to date with current treatments and treatment recommendations, and trying to stay on top of all the changes and trends in dentistry. So when I was young, I used to work here at Pennino Family Dentistry in the back, kind of cleaning instruments and taking care of things behind the scenes. At that point, I saw the way that my dad practiced and communicated and connected with his patients, and realized that this was something that I wanted to pursue and kind of devote my life to. In order for me to give a positive experience for the patient, a lot of the times I'm looking for what makes them anxious. So usually I'll ask them that question: What are you nervous about? What are you worried about? And we'll use that to try to figure out a way around it, to make the patient more comfortable, to make sure that they have a positive experience with dentistry, because a lot of people haven't had that in the past. So good communication is paramount. It's super important in figuring out how to create a good experience for a patient. For example, usually if I have a patient who I suspect is maybe a little nervous about something, usually we dive a little deeper and try to figure out what exactly that is. Because a lot of times there's a way to work around it, whether it be the sound of the drill, or we can use headphones or something like that. Usually there's a way around whatever is causing them to be anxious or nervous, and we're always searching for that to create a good experience. I have a few memorable patient experiences. One from more recently was a new patient who came in for a second opinion on something that was recommended by another doctor who she just wasn't comfortable with what was going on. So I had a chance to sit down with her and walk her through my rationale and basically confirm what the other doctor had recommended. The only difference is that I was able to explain and give her a rationale for what was needed. So we did the treatment that day. Everything turned out great. She was thrilled, very happy. She actually went out right after the appointment and picked up flowers for myself and my coworker, my assistant Grace, and came straight back to the office. She was so happy, and so that was something that provided a lot of juice for us moving forward. It's always good to hear back from happy patients like that. So we have utilized quite a few technologies here in the office. One that is most frequently used probably is our scanners. So we have 3D scanners to, in certain situations, reduce the need for impressions and things like that. It makes life a lot easier for the patients, and we can use those scanners to connect with our 3D printer to create models, or a lot of times do same-day restorations like crowns and things like that here in the office, where you don't need a temporary or an impression. It saves a lot of time and a lot of hassle for patients, and super convenient. We're always trying to stay up to date on current technologies and things we can implement in our practice. One of the ways that we do that is through our study club. So we're always meeting with other doctors and local dentists and trying to find new things to implement into our practice and stay up to date with current technologies. Here in the office, I do a lot of the anterior bonding cases. I find a lot of joy in doing that, because oftentimes we are working with younger patients who maybe could use a self-esteem boost and are looking for a conservative option as opposed to traditional veneers or crowns on front teeth. This method allows us to be ultra conservative and save a lot of tooth structure while still providing a significant change in aesthetics and really improve a lot of times young patients' self-esteem with this technique. We do a lot to stay updated on the latest dental techniques. The most important one to us is continuing education. So we're frequently spending time heading down to Arizona and seeking out new techniques and new methods at the Spear Education Center in Scottsdale. So we spend a lot of time there and always have something to bring back to the office to implement very quickly. So what sets me apart is I am a big fan of conservative dentistry. So I am always looking for a way to preserve and save tooth structure and do things in the most conservative way that I can while still delivering a long-lasting and strong result. So creating a comforting and welcoming environment is super important to me. Usually I'll do that by communicating as best I can with the patients before any type of procedure that they're maybe unfamiliar with. So asking the important questions to try to figure out how I can personally make their life a little easier through the dentistry that we need to do together. And the key to that for me is just open and honest communication. So I love to cook. A lot of times, if I got free time, I'm trying to search for something to do in the kitchen. So in the kitchen and in dentistry, a lot of times you're juggling multiple things, trying to time things correctly and stay on top of everything. And I find that the ability to multitask while prepping and cooking a meal applies pretty well to dentistry also. So I find myself kind of in the same mode a lot of times when I'm here in the office as well. So we spend a lot of time here in the community. We're constantly looking for ways to reach out and teach, basically. So we're spending time in preschools and retirement communities, explaining to them and trying to educate them as best we can how they can best care for their own dental health. So it's super important to me that patients are well informed about their dental health. The way that I accomplish that is make sure that I have adequate time for each patient. So I never want a patient to feel like, I got to be somewhere else or I can't answer all of their questions before I leave the room. So something that's very important to me is making sure that I spend the time and answer any questions from any patients that they may have while they're here and before I move on. In our office, we're starting to implement more and more orthodontics, so more Invisalign here in the office. We're taking a lot of steps behind the scenes to spend more time and provide as best care as we can for those patients. Here at Pennino Family Dentistry, we're always focusing on growth and reaching more people, but it's really important and vital to me that we really strive to maintain a family feel here at the office. So when you come in here, we want you feeling like you know each and every one of us and we know you as well. So that's super important to us, that we always want to treat each patient like they're a family member here when they come in. So here at Pennino Family Dentistry, our patients can expect to experience personalized care and always professional and kind attitude from each and every provider that you see here at the office.